We're here today advocating for Medicare for all, otherwise known as a single-payer healthcare system. The public needs to know a simple, clear message. And Obama's message is very confusing and complicated. People don't understand it. And so the right wing takes advantage of that, and they get their simple message out and they win the day. We need a simple message that says Medicare for all. Black, white, Latino, Asian, African, young, old, sick, poor, rich, poor, I don't care what it is, but we need health care for everyone. We need the rich subsidizing the poor. We need the young subsidizing the old. We need health care for everyone. So our message today is Medicare for all. Health care is a human right. It should be based on need. It's kind of like what Social Security was in the 30s, and that's the message that Obama should be getting out to the public. That's how this debate needs to be framed.
So are you for or against his current plan?
I am against his health. I am only for healthcare as a human right based on need, and everybody in, nobody out. That's what single payer is all about. What we're trying to say here today.
What would you say to the skeptics that would say that it's going to raise taxes and just cost them? It's going to raise the deficit.
It would not raise healthcare. Single payer Medicare for all pays for itself. It would not increase the deficit. It would not increase the debt, and the government's books would be balanced. Everybody's books would be balanced because it pays for itself. So you're getting the administrative waste out of the system. You're by supporting single payer, you're eliminating a costly layer. And you'd also have the economies and efficiencies of scale that Medicare already has to leverage huge discounts from drug companies, medical device companies that sell the defibrillators and pacemakers, and again, the drug companies and hospitals. That's the only way. It's got to be everybody in one pool. Black, Latino, Asian, African, white. Baby needs a doctor. Let's stand up for our rights. It's got to be healthcare is a human right based on need, government guaranteed.
What would you say to capitalists that might say that by having only government single payer that would ruin efficiency and competition and raise prices?
There is no competition. Every attempt at turning people and patients into consumers has not worked. That's why we need healthcare has to be a public good. It's not a market-based item. Patients, sick people should not be turned into consumers who have to shop around, compare prices, compare quality of care. That's not what happens when people are vulnerable and ill, when people and their families. People, you need care, you get care. It's as simple as that. It's not. Healthcare is not about markets. Healthcare is not about premiums and copays and deductibles. Healthcare is about you need care, you get care at the ready. Everybody should be near a clinic. Everybody should have access to a hospital when they need it. It's a public good. It's like the fire department. It's like the police department. It's like parks, roads, and education. It's a public good. It's not a market.
Do you think by going to the public option, again, the skeptics would say lead to possibly rationing and government deciding who gets health care? Do you think that would be a factor?
If you had a robust public option that could get as many people in as Medicare has. Now, Medicare operates very efficiently because it has 45 million people in it. So if you had a public option and you could get another 40 million people in it, it could continue to operate very efficiently. It could continue to leverage the waste, fraud, and abuse from the insurance companies. It would keep the insurance companies honest, and you would have to make sure that there's no cherry picking, because every health insurance company cherry picks healthy people and they try to exclude older, sicker people. You have to have these safeguards if you're going to have a public option. And Obama's got to go after the insurance companies. He's got to go after the drug industry. He's got to go after.
What do you think is the main problem with the insurance companies?
Insurance companies profit by denying people health care. It's as simple as that.
So you don't think they should be able to make a profit, or? Absolutely not.
Healthcare is a public good. It should be nonprofit. Insurance companies are about denying care and coverage for profit.
Doesn't that give the incentive to doctors though to go to school and to want to be a doctor. You know, the fact that they're going to make a profit, that makes doctors want to go to school.
Doctors, HMOs are a monopoly. Doctors have no negotiating power. If you had a Medicare for all system, or even statewide single-payer systems, doctors would be in a much better position because we need to do something about the monopoly of HMOs. HMOs stands for hand the money over, is what we call it. So you need doctors would be able to, and pharmacists and social workers, they would be able to negotiate as a profession with the single-payer health plan, which would be a board of citizens.
Okay. So again, regarding Medicare, the skeptic would say Medicare is broke, and do we want these same people running this?
Medicare is not broke at all. Medicare operates on a 1.45% payroll tax. You could increase the 1.45% to 1.55%, a very small increase. And Medicare is a completely solvent system. That's completely a distraction and a fear tactic. Medicare is a very solvent system. All you have to do is have the government negotiate drug prices for seniors for Medicare Part D, get rid of HMOs and the $15 billion a year in their windfall profits, have Medicare operate on budgets, and you can even increase the payroll tax that people have been paying for the last 45 years by a very small percent. Medicare is a solvent system, and I think that's Obama's problem, is that he keeps on talking about Medicare and Medicaid. Those are good systems. We got to get rid of the insurance companies. That's what the problem. That's what's bankrupting these countries, the insurance companies.